Hi, welcome back. My name is Dr. Mary Ann Shepard, and I'm happy to be bringing you this month's series on instructional assessment for severe and profound disabilities or for behavior concerns. And so during this video, we're talking specifically about assessment strategies that you can use with your severe and profound students. A lot of times parents appreciate what we're doing, and they really appreciate that we are trying to address foundational knowledge, such as knowledge of the ABCs or counting, simple addition, and even some social studies. But as children get older and they're in 4th, 5th, 6th, 7th grade, and we're still working on ABCs or counting, and parents are realizing that these skills are not going to be as applicable to their everyday life long term, and that their child might not learn to read, or their child might not be able to do some addition, or be able to only do very foundational addition. Parents are looking at, okay, how do we start transitioning to those functional life skills, and how do we start looking at meaningful educational objectives for their child that maybe aren't as academic focused, but maybe are more social, communication, foundational skills. And when we get to that point, a lot of times it's really hard because we have our Common Core standards and we have our core curriculum and our state standards, but those don't necessarily apply to functional life skills. And so then we're kind of creating goals from things that we find that are meaningful, but there's no way to compare those to other schools or to other children. There's no way to know, are these goals everything that we should be doing? So there are a couple of established tools out there for developmental disabilities, and you've probably seen some of these tools through their standardized assessment that they receive as part of their qualification or their MEAGS process. And so maybe you're familiar with the BB map or the Vineland or the ABAS. These are some common assessments that might be utilized as part of that diagnostic assessment, but you can also use those tools to guide intervention, education, and treatment. And so I'm going to talk about 4 different tools that you can use in your classroom, especially when working with those severe and profound children or children on the autism spectrum, children with severe communication delays. So one of them is the ABLS, ABLLS. And the ABLS is the assessment of basic language and learning skills. Okay, so we're looking at very basic and foundational language and learning skills. This assessment is good all the way from developmentally, birth to 12 years old. Okay, so this assesses a wide range, whether you're working with an 18-year-old that maybe functions around the 5 or 6-year-old range, or you're working with a 4-year-old that maybe is still in those early toddler years or infancy stage. And so these scores can be used to create a curriculum for the student. The ABLS, one thing that you want to know about the ABLS is the administration. If you're administering the entire ABLS, can be very lengthy. However, if you're looking at the school year, and this is your initial administration, okay, so your very first administration, if you're looking at administering that, it may take you a week to go through and do a comprehensive assessment. However, once you've done that initial administration, you're just building upon that, so you don't have to go back and do that full administration every time. Or if you're working with an older student, you don't need to assess every skill all the way from birth up to wherever they're currently at. And so you can administer some pieces and parts of this as well. So don't feel like you're stuck administering every single item on the ABLS. So know that you can do some pieces and parts of this. The things that the ABLS measures, it measures their visual performance, so like their visual tracking. It measures their receptive language, so what are they understanding as far as one-step commands and types of receptive language. What can they do as far as imitation? And imitation is really important for learning, because a lot of learning is imitating whatever the instructor is doing. And so if I say cat, you have to be able to imitate cat. If I say touch your nose, you have to be able to imitate that. Or if I say do this, you have to be able to do that. And so imitation is really important as a foundational skill that we see in infancy and toddlerhood, early toddlerhood. And so you want to see, are they able to imitate? You're looking at their expressive language or their verbal behavior. So what can they do? Can they do verbal imitation? Can they request items? Can they label items? So you're looking at some of those verbal skills. You're looking at their play and leisure skills. As you know, as a teacher, leisure skills are really important. They're really important to parents because a child who doesn't have play or doesn't have leisure, they tend to just dump things or aimlessly wander about getting into things that they shouldn't. And so leisure skills like being able to sit and do a puzzle or play with blocks or color a page are really important because they keep the child occupied while you're transitioning or doing other things in the classroom. So sometimes you really have to teach leisure skills, and by teaching leisure skills, it makes a huge impact in their long-term life because as adults, we need leisure skills. What are you going to do in your free time? It talks about group instruction, so what can they do as a group? It talks about classroom routines, generalized responding, and cooperation. So the ABLES is an excellent measure. It's a very comprehensive, but it can be a little bit bulky. If you're looking at an entry-level assessment, maybe you don't have as much knowledge or experience. Also with the ABLES, you're going to want to get some training on that. And so you can find some online trainings for the ABLES and the BB-MAP. I know the BB-MAP, we're going to talk about it here in a minute. There's a good training on that through the Florida Institute of Technology. And so you can find some training on the ABLES as well. The next, which is a very basic assessment, is the Vineland 3 or the ABAS 3. These are both rating scales, and so you can get a teacher rating scale, so that would be you or the classroom teacher, and maybe the paraprofessional would go through and rate the child on each of the behaviors that are being measured. There's also a parent rating form, so the parents would be able to rate them at home, and then you would score that. You would get a standardized score from that, but then you can also look at individual items that are answered on that. And so typically, like with the Vineland, you're going to answer never, sometimes, or often, or 1, 2, 3, almost always does this, or frequently does this, sometimes does this, or never does this. And then you're going to take those skills that maybe they're sometimes doing, and you're going to make those, you're going to bolster or teach those to mastery. And then you're going to start introducing those entry-level skills that they never do, and you're going to start introducing those. Every year you would re-administer this. One thing to know about the BB-MAP is you may not notice great changes in the standardized scores because they're comparing them to other children their age. So if other children their age are developing at a faster rate than them, their standardized scores may not have as much change. But what you're really going to want to look at from year to year is that item analysis. Are we reaching a higher level as far as our items go each year? And so that's the same for the Vineland 3 and the ABAS. Both of those are good tools. They're both very easy to administer. They have rating forms for multiple caregivers. They assess things in communication, daily living skills, socialization, play skills, leisure skills, health and safety skills. So things that are very important to parents. And the last one that we're going to talk about is the BB-MAP. This is the Verbal Behavior Milestones Assessment and Placement Program. Like I said, you can get a good training on this through the Florida Institute of Technology. It's very similar to the ABLES, where you're going to be administering individual items. The biggest difference between the BB-MAP and the ABLES is the ABLES is looking at a broader set of skills. So they're looking at that play and leisure and group instruction and generalized responding, whereas the BB-MAP is just looking at communication. So it's looking at, can the student, what do they understand receptively, what do they understand expressively, and what can they do with another person as far as what they call interverbals. Okay, and so there's a lot of skills in the BB-MAP that are also being assessed, such as requesting, labeling, vocal imitation, listening skills, that motor imitation, so sign language type motor imitation, but also motor imitation for play skills. They are looking at leisure and play, social skills, classroom skills, but it's focused more on verbal skills within those settings, okay? So I encourage you to look at each of these assessment tools, the ABLS, the Vineland, the BB-MAP, and the ABAS. All of them are going to cost a little bit of money. So they don't come free. They have different varying levels of cost and levels of administration that you would need to give. But I do think that they would provide more direction, very similar to a curriculum that you might have in math or reading, that's more targeted towards that severe and profound population. I hope you find this information useful and helpful. You can find more information on our YouTube channel or Facebook page or our website at www.everydaybehaviors.com. And I ask that if you like the information you see, please like us or follow us on YouTube and Facebook. Thank you.